All right, guys, so what we're going to learn right now is we're going to learn how to do vital signs. And again, this is part of working as a caregiver. So whether you're working with APD or whether you're working with the Florida Department of Elder Affairs as a med tech, you may have to do a set of vital signs on your patient. So you need to know what they are and how everything works, okay? So the very first thing that we're going to talk about is we're going to talk about blood pressure. So what is a blood pressure? Well, the blood pressure measures the amount of blood going through the veins and the arteries, and it gives a amount, okay? So by example, when we talk about systolic and diastolic, we're talking about the top number of the blood pressure and the bottom number of the blood pressure. So the systolic is the highest or the most amount of pressure in the walls of the arteries versus the bottom number, or what's called a diastolic. And so that's the least amount of pressure in the walls of the arteries, okay? And in order to do a blood pressure, we have to have a blood pressure cuff, okay? And so this is a blood pressure cuff, and there's a couple of things on here I want you to look at. Number one, this is attached by Velcro. You have a dial on it, and with the dial, each one of these little marks on here is worth 2 points, okay? So this starts at 20 and it goes 22, 24, 26, 28, 30, so on and so forth, all the way up to 300, okay? So you have to understand that every time you see one of those little itty bitty marks, that's a 2-point mark, all right? The other thing I want you to look at is on here, and this is detachable. The other thing I want you to look at is you'll see where this says artery and then it has an arrow. So when you place this on your patient's arm, you want the artery arrow to go directly over the artery. So if I was placing this on my arm, this is called the brachial artery right here. And so we want the arrow to go directly over the brachial artery because this is where the bladder is. And the reason why we want that is because the bladder is going to help with us hearing, so the acoustics of hearing the blood pressure. And what you're going to hear is a p. So that's what the heartbeat's going to sound like when you have a stethoscope on. So as you let the air out, you should hear a p, 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 p. So that's what we're listening for, okay? So that is our actual blood pressure cuff. Now, in order to hear the blood pressure, obviously we have to have a stethoscope. So here is our stethoscope. These are the earpieces. These go in your ears, okay? Now, you will have different types of stethoscopes, and this is my own personal stethoscope that I utilize with patients. So it doesn't really matter what kind of stethoscope you have. You'll have stethoscopes that have what we call a dual head, and then you'll have a single head. Now this actually is like an all-in-one because this can be listened through clothing and everything. So this is a really, really good stethoscope. But I've seen students and other nurses and physicians and that they'll use a dual head stethoscope. So one side is a small, what we call a small bell, and the other side will be a larger. And that is for listening. The smaller one, which is open, is more for listening for like heart sounds. So we want to listen to heart valves, or if we have a pediatric patient that we need to really listen into something, we turn it to that small bell and then we can hear more precise sounds. Other than that, we just use the general larger side. So if you have a dual head stethoscope, okay, make sure that you put it on the larger flat portion, okay? So that's in order to hear. Now, when we want to do a blood pressure, your patient should be either sitting or lying down. Now, if they're lying down in the bed, so our mannequin is lying down today. So if they're lying down in the bed, if we can, we'd like to put either a pillow or something up underneath their arm because your goal is to get their arm at about heart level, okay? Also, depending on how short or how tall you are, you may need to move this bed up or down, just depending on you. But we don't want you hurting your back, so use correct body mechanics and utilize the bed as you see fit. So if you need to put it up, put it up. If you need to put it down, put it down. Now, we also need an alcohol swab because we have to clean off our stethoscope before we use it on anybody. So again, that's how we transmit infection. If someone had, you know, some kind of infection and we used our stethoscope and then we come in here to Mrs. Smith and she doesn't have that infection and we didn't clean it off with alcohol, we could transmit something to her. We don't want to do that. So remember, your goal is patient safety. This is part of patient safety, okay? So we're gonna go ahead and use our alcohol swab, and we would go ahead and cleanse off our stethoscope. So you can use 2 alcohol swabs. If you're using like what I call the community stethoscope, which is everybody's, get 2 alcohol swabs. 1 to clean off the earpieces and 1 to clean off the actual stethoscope itself. So we're just gonna clean this off. Some people go as far as actually cleaning the whole tubing just in case it touched somebody else's body, and that's okay, you can do that as well. And then the last piece that we need is gonna be either a pen and pencil and paper. So you have to write down your information immediately, okay? So now the way that we perform a blood pressure is we're going to take the blood pressure cuff and we're going to attach it to the patient's arm. Now, you can't just use any kind of cuff. You have to make sure that the cuff fits the patient. So if you've got a very, very small patient, like let's say you have a 100-pound patient, you can't use this cuff. This is a regular size cuff. It's not gonna fit the patient correctly. So you need to get probably a pediatric cuff. If they were a large size, like me, I'm a pretty big girl, this cuff is not gonna fit me. I would need the larger cuff size, the extra large cuff size, in order to get a correct reading. If the cuff does not fit, the reading is not gonna fit, okay? So kind of think of it like that. So if I have a very small cuff, but I've got a very large person, your blood pressure is gonna be really, really high. If I've got a very, very small person and a very, very large cuff, your blood pressure is gonna read very, very low. So it's not gonna be accurate, and this accuracy is key to keeping your patient safe. And the reason why I say that is because there are medications that we may need to give a patient, and they're gonna go according to the blood pressure. So if the blood pressure is not correct, you can wind up hurting a patient, okay? So we're gonna take this blood pressure cuff, we're gonna go ahead and stick, I put a towel up underneath the patient, I just folded it up. That's to kind of get the arm up underneath there. But if you have a pillow is even better, it makes it more comfortable. But I'm gonna place the cuff on her arm, and this goes on the upper portion of the arm. And so we were looking at the arm, it would go on the upper portion of the arm, and this is the antecubital area. And so we wanna place the cuff approximately 2 to 4 inches above the antecubital area. So this is the antecubital area. I want to go about at least 2 inches above that. So the end of the cuff should stay right about in here, okay? That's about 2 inches. Okay, so I put that on there. I'm also looking for the artery. So remember, we have the arrow for the artery. We want to go ahead and place that cuff over, basically on top of that brachial artery. Because, you know, if I can put it over there and the acoustics are better, it's going to help me make a better determination of what the actual blood pressure result is. Now, I'm going to take this, I'm going to attach it to the blood pressure cuff. So it just has like a little hook here. So we put that on. And then this is my pump. So when I have this in my hand, I want this dial here to go to the right-hand side. Okay, this is my right. So I want the dial to go pointing to the right-hand side. When I go forward, I cut all the air off. So nothing's gonna come out of this. When I go backwards with this, so I unroll it, all the air gets let out. So one thing that you have to master when you're doing a blood pressure is you have to really learn how to control the air. Because if you can't control it, the air just zips on out of there and you're not gonna get no kind of correct reading. And so that's really, really important. So in order to start, I'm gonna cut the air off, okay? Remember, you're gonna be holding this with one hand, so don't do it so tight to where you can't control it with just your thumb. So you should be controlling it like this, okay? All right, so now we're gonna go ahead and put our stethoscope. We've already cleaned it. We've explained to the patient, Mrs. Smith, I'm gonna be measuring your vital signs. I don't wanna say I'm gonna take your blood pressure, because that might, if she doesn't understand the terminology, she might think that you're gonna take blood from her and she's more likely to refuse. So we're gonna say measuring your vital signs, okay? So Mrs. Smith, I'm gonna measure your vital signs. So you notice I've placed a towel up underneath your arm to kind of raise it up. I'm gonna put my stethoscope in my ears. I'm gonna test my stethoscope to make sure that it's working. I'm gonna find the brachial artery. So have your patient do palm up for you. So Mrs. Smith, if you'll do palm up. And I'm gonna follow along the pinky, because that is the path that the brachial artery follows, okay? So here I'm gonna take my 2 fingers, not a thumb. I'm gonna follow up the brachial artery and right here to the antecubital area, and if I can feel it, I can hear it. So I'm gonna place my stethoscope right where I feel it, okay? So here I'm gonna go ahead and find the brachial artery. I found it. So I'm going to place my stethoscope on top, all right? So now at this point, according to textbook wants you to pump up the cuff to approximately 180 to 200. Now, I want you to remember everybody's body is different. So textbook tells us one thing, but everybody's body is different. So some person may not be able to handle 180 or 200. So you have to kind of gauge them as you're pumping it up. If you see they're going, that may be an indicator to say, hey, you know, kind of take it slow here. So some people, though, have bad hypertension, uncontrolled hypertension, and their blood pressure may be way over 200. So you pump it up to 180, and the first thing you're going to be hearing is a heartbeat as soon as you stop at 180. Well, that tells you, if you can hear a heartbeat right there, you haven't pumped it up high enough. So when we put that stethoscope in our ears, we've got the stethoscope right on top of that brachial artery, and we're pumping it up to the 180 or 200. When I stop at the 180 or 200, if I hear a pulse, I need to pump it up one more time and listen. If I still hear a pulse, I pump it again. If I still hear a pulse, I pump it again. So in conclusion here, I keep pumping up until I stop hearing a pulse. But you have to do one pump at a time because we don't want to go way over than what we need. Now, once you stop hearing a pulse, very, very, very slowly, you're going to go ahead and release this air. Very slowly. So make sure you got good control over it. So you're going to slowly release the air. You're going to be looking at your dial here, okay? And it should be so slow that it actually stops at every single one of those little checkpoints, okay? So remember, those are 2 points each. So it should be stopping at each one of those. That's how slow it's going. Now, once you start releasing the air, as soon as you hear that first heartbeat, shut your air off, because you want to ensure, number one, is this jiggling around and making it sound like a heartbeat, or are you really hearing a heartbeat? So if you kind of clamp off that air and you stop and you listen, not only are you going to verify that it is a heartbeat, but you're also going to see what number is it beating at, because that's really, really important that we become accurate in what we're telling our nurse or what we're telling our practitioner. So we're going to stop that air, we're going to listen to it. Okay, it is a pulse, and where is it? Oh, okay, it might be at, let's say, 160, all right? So that is our top number. Now, as we found out what our top number is, now we need to, again, slowly release that air, allowing all of it to start to escape, and you'll notice that the pulse is going to start getting a little bit lighter. So when you first hear it, this is how it should sound. By the time you start getting to the end, it's going to lighten up. Okay? So we're listening for the very first heartbeat, and then we're listening for the very last heartbeat. So the first heartbeat is your top number, your last heartbeat is your bottom number. That's what you're trying to get to, all right? So let's show you exactly how it goes all together. Cuff is on, over the artery, I find the brachial artery, I feel it. Place my stethoscope on top of it. I've got my dial. I'm going to pump up to the 200. Okay, I hear a heartbeat, so I need to go up one more pump. Okay, I don't hear a heartbeat anymore. I'm at 220. I'm very slowly going to release my air. Okay, at 190 is when I start hearing my first pulse. So I start to release the air some more. I'm hearing a beat, 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 beat. When I get down to 110, it stops. So now what's my blood pressure? I first heard it at 190. I last heard it at 110. So that means my blood pressure is 190 over 110. Okay, and so that's exactly what I would go ahead and write down on my paper. Now, let's discuss what's normal, okay? So when we look at a blood pressure, your normal ranges are from 90 over 60, so 90 on the top, 60 on the bottom, to 140 over 90, so 140 on the top, 90 on the bottom. That is your normal range. If you are below the 90/60, you are considered to have hypotension at that particular point. Now, you may not get diagnosed with hypertension because it takes more than one time to be diagnosed with something. So, but at this point in time, you may have hypotension. Now, if you're over the 140/90 and you're consistently over a number of days that your practitioner deems what he wants, then that may consider you to be having hypertension. So hyper is high, hypo is low, okay? So we would need to know what is our patient's range. So if I've got a blood pressure of 190/110, is that hypertension or is that hypotension? Well, this falls under hypertension because it's over 140/90, okay? And so that is how you would do a blood pressure. Now, the other parts of vital signs are going to be pulses. Pulses are from 60 beats a minute being the lowest to 100 beats a minute being the highest. If it's below 60, it's considered to be bradycardia. If it's above 100, it's called tachycardia, okay? Bradycardia or tachycardia. Tachycardia is fast, brady is slow, okay? So we also need to know, is it irregular? Is it regularly irregular? So irregular means that it beats, so bump, 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 bump. That's irregular. Whereas regularly irregular, it means bump, 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 bump. So it's consistently irregular. So irregular is kind of all over the place, where regularly irregular is a consistent irregularity, okay? We also need to make sure that we're counting the pulse for 60 full seconds. So whenever you find the pulse, which the way to find a pulse is with your 2 fingers, starting at the tip of your thumb, going right here to the groove. So once you find the pulse, you're going to count it for 60 full seconds. So you're not counting the clock, okay? If you start using the clock, you're going to start probably around 12 or 6, whichever one you choose. And once you've got that pulse and you start at 12 or 6, you need to turn your head away. And the reason why is because if you sit there and you look at that clock ticking away, you're going to be counting the clock. And what you want to count is what you feel, okay? So when we look at the clock, we find 12, we've got our pulse, we say, okay, I'm going to look away, and I'm counting what I feel. And every now and then, I'll glance back at that clock because I don't want to go over a minute, all right? Now, you'll see out in the field, a lot of people will say, well, you can take the pulse for 15 seconds and multiply by 4, or you can take the pulse for 30 seconds and multiply by 2. You can do that, and that's true and correct. However, if someone has an irregular rhythm, you may not get the right numbers. And that's going to be critical when we're talking about giving patients their medications. So if someone is on a medication, like let's say digoxin, which is a type of cardiac drug, if they're having digoxin given to them, then there's going to be a parameter of you don't give the dig if the pulse is below 60. Well, if they have an irregular heart rhythm and I only counted for 15 seconds and multiplied by 4, I could be off by multiple points or multiple beats. So in this case, I give digoxin where digoxin is not needed, and then something happens to my patient. So this is the reason why you should be counting for 1 full minute instead of doing the other routes, even though the other routes are still considered to be acceptable practice in certain places, okay? The last thing is going to be your respiratory rate. So respiratory rates normally are from 12 to 20 in a minute. And to understand a respiratory rate, you need to know the different components. So there's an inspiration, meaning you breathe in. There's an expiration, meaning you breathe out. And that equals 1 respiration. So is 1, okay? So 12 to 20 in a minute. And again, you're gonna look at the clock when you're doing this. You're gonna do 60 seconds. So start at 12 or start at 6. Once you're gonna look at the chest, or you can even put the client's hand over their chest or the patient's hand over their chest, and you look at the clock, you start at 12, but you're gonna look away and you're gonna count either what you see as far as rising and falling, or what you feel as far as rising and falling. So you're not taking the pulse, but you're kind of like tricking the person to think that they're taking the pulse. Now, the reason why you do that is because if you tell someone, I'm gonna check your respiration rate, they may do this. and stop breathing, and we don't want them to do that. So with the pulse, it's really, with the respiration rate, it's very, very important to say, you know, I'm just going to measure your vital signs, but you don't really need to tell them exactly what you're doing, because we don't want them to, you know, unknowingly or knowingly alter the records. Okay. All right, so that is your pulse and your respiration, and then your temperature levels. Well, you know, 98.6 is normal. Now, if you're going to do a rectal temperature, remember that the rectal temperature will always be a degree higher. So if 98.6 is normal, then that means 99.6 through the rectum is considered to be a normal temperature. And then if you do it up underneath the armpit, it's always a degree less. So if you got 97.6, that's normal, because up underneath the arm is always a degree less. All right, so orally is 98.6, rectally is going to be 99.6, and up underneath the armpit is going to be 97.6. Now remember, anything that's a 99 or above, a lot of the times is considered to be what we call a low-grade fever. And that means there's a possibility of an infection coming on. So it might be the beginning of an infection. So when you start getting in that 99 area, we want to keep a close eye on the patient. See if there's anything else going on with them. Are they vomiting? Are they coughing and sneezing? Are they sweating? Do they have chills? So on and so forth. So that tells you, if you start seeing stuff like that, you need to let the practitioner know. Okay, that's it with our vital signs demonstration. Have a great day, guys.